glad you're here, and we have a very special guest as part of our Meet the Partners series today. Joining us is Dr. Foutz, longtime Henderson dentist. So welcome to the podcast.
Thank you very much for having me.
We are thrilled, and you have an amazing story of longevity and legacy here in Henderson. So you're going to have to share a little bit about your background here with our audience today.
Sure, happy to do that. I'm a fourth generation dentist.
Wow.
My great-grandfather started practicing, and they apprenticed back in the day in central Utah, because Las Vegas doesn't, there are two ranches here in the 1880s.
The 1880s.
Yeah. So he started apprenticing in the 1880s, did a little short stint in Chicago to get some further training, and then practiced until about 1937. And then my grandfather graduated from Loyola in Chicago and practiced in Utah because Las Vegas still wasn't a thing then, but then eventually moved here in about 1941, 42.
Wow.
When it was still smaller than Pioche,
Oh
Nevada, which is the town he moved from.
That's amazing.
And so my dad graduated from Las Vegas High School, and then he went to school in Chicago as well, Northwestern.
Okay.
And then he was drafted, and so that is why I was born in Japan.
Wow.
When he was in the Air Force, right after dental school.
Wow.
And so then I watched my dad's example and thought, this looks good. I love to work with my hands, like to work with people. And so pursued the pre-dental and decided, this is for me. And so I went to dental school and graduated from University of Pacific in San Francisco.
Okay.
And so that was a great place. Met my wife there, too.
Oh, congratulations. How many years have you guys been married?
We just celebrated our 40th wedding anniversary.
Wow.
Yeah.
Congratulations.
We got married like a month before I graduated.
Okay, so now I have to ask, what is your best piece of advice after 40 years of marriage?
Oh, patience, listening, and try to have fun.
I love that. I love it. So after you graduated dental school, you guys moved back here to Henderson then?
I spent a year in Salt Lake City.
Okay.
There was a residency, a general practice residency, that I was able to do at the VA hospital there.
Okay.
And it just gives you a lot of extra experience and things that you wouldn't normally see. And so did that, and then moved to Las Vegas, Henderson area, and started practicing in some group practices, and then pretty much got my practice going from the get-go, but then as it expanded, moved into one location off of Eastern and Harmon about 35 years ago.
Wow.
And then our current location in 2002.
So you've been in your practice for long enough now to where you've seen different generations. You've seen kids grow up, and now you're seeing their kids.
I'm seeing adults now that I saw as little tiny kids.
That's amazing.
Yeah, so it's kind of fun.
Because it is a family practice.
It is.
So you see all different kinds of
through
ages.
the years, absolutely.
I love that. So if you had to say, what are some things that people may overlook, when they come into your office, just things that you guys would see that we might not notice, what would some of those things be that people often overlook?
Well, I think we all have a little bit of human nature, right? Let's try to get something done as fast as possible.
Of course.
And, the devil's in the details. And so we're always encouraging people that we only want you to floss the teeth you want to keep.
Yep.
Okay.
I know. Oh, I'm so guilty.
So things like that.
Yeah.
Sometimes people discount the importance of replacing missing teeth.
Oh.
How much stress that puts on the remaining teeth, especially in the front. We need those back teeth. They'll say, well, no one can see it.
Yeah.
But when you're missing that tooth, it's less support. The front teeth have to do more work, which they're not as biologically designed for.
Okay.
And so replacing those missing teeth one way or another is a very important thing that sometimes people discount.
Interesting.
And obviously people focus really well on looks and the way things look. That's kind of first in their what they look at.
Of course.
Especially as we look in the mirror.
Yep.
But our job is to kind of point out what things would be functionally help them as well as look good. And so marry the two of those things together. And let them participate in the decision making. I mean, I think that's very important.
Oh, yeah.
But educating and showing them the importance of these various things that maybe they just weren't aware of is also a very important part of my job.
Does the Sonicare or one of those types of toothbrushes replace flossing?
No, it does not.
Oh, no, I'm in trouble.
It does a great job.
Yep.
But flossing And, no matter how good the brush is, it's only going to get about 60% of the surface of the tooth.
60%?
Yeah, because it can't get in between the teeth. It tries,
Yeah.
but it can't quite get there.
Okay, you're
And so
inspiring me.
there's a variety of methods, floss being one. There's little interdental brushes you can use as well. Water picks are great.
Yep.
All those things, but water picks and flossing do two different things.
Yep.
So they don't replace
One
each
doesn't
other.
replace the other.
But it's just
You
just
need it
want
all.
to do that for the teeth you want to keep.
Oh, okay. I am inspired from this conversation already. And you have called the mouth the gateway to overall health in our bodies.
Yes.
So explain what you mean by that.
So I think it's becoming more prevalent that we understand that our bodies, I think it's somewhere around 30 to 40% of our weight is actually a microbiome. There are bacteria that live symbiotically with us that help us process, digest food. They even help us know what we like and what we don't like. Of course, our genetics play into that. So when we have harmful bacteria that we've got in our mouth that we can have, if we aren't controlling and taking care of that, it can affect all different systems in your body, from heart and vascular to even brain health to the way we eat, kidney function, your circulatory system, all of those things. So obviously it's something that we hopefully can control is what we put in our mouth and how we take care of our mouth. So that's why it's the gateway to your health. And there's so many diseases and maladies that can manifest themselves in the mouth. I'll have someone that'll come in and they'll maybe have some decay on one side, right back in the cheek on the bottom. And I'll ask them, so have you had any acid reflux lately? And 9 times out of 10, they'll say, well, yeah, it's not that much, but yeah, I've tasted that. I'm going, and do you sleep on your left side? Yeah. And so we can find things like this and talk to them, okay, let's get you to your internist and see what they can do about acid reflux. Help you with that. Let's help in the same time. Let's try to protect your teeth so from the effects of that acid that may just occasionally come up, but it's very powerful.
Yeah.
I mean, anyone that's thrown up, that's awful stuff.
Yeah, absolutely.
And so we want to protect our health by protecting our mouth, and that's why it's the gateway to our health.
It's interesting that you brought up sleeping on one side, and you can tell what side people sleep on at night. And one of the other things you and I have talked about in the past was sleep apnea being something that you guys address as well, which I would never have thought that a dentist could treat sleep apnea. Right. But it's definitely something that you guys can help with.
So the way that we look at it from a dental standpoint is people see their dentist more often than they see their medical doctor.
For sure.
That's just established, And so for us to do some screening for that and be familiar with some of the signs and symptoms, we just ask, are you aware of any snoring, or does your sleep partner complain about any snoring?
I got a big snore at home.
Yeah. Ugh. And so and so we have that discussion, and we have the discussion that many times snoring leads to a drop in your oxygenation level, and it can be having that periodic drop, which is sleep apnea. I mean, that's what it is. It can be obstructive. It can be central. There are many of us can administer home sleep tests and get them read by a certified sleep technician. We're not trying to interpret all the data.
Of course.
But there are treatments that we can offer for mild to moderate cases that can be very effective and less obtrusive than, say, a CPAP.
Yeah, because those can be a lot.
That's a lot. Now, having said that, I'm not anti-CPAP for sure, because for someone that's severe, you need it. You need that positive pressure. You need the air. You need everything helping you to put you in the best possible situation.
Yep.
And so that becomes the gold standard for a severe case. Now, for a mild to moderate, an oral mandibular night guard device that simply opens up your airway and allows you to breathe without that tissue falling back and obstructing your throat and down deep will be more than adequate and help solve the problem and not have to go as far as CPAP.
Wow.
It's an interesting statistic to know that 60% of the people who are prescribed CPAP are the ones that wear it.
Only 60%?
Only 60%. 40% take the device, take it home, sits on the shelf.
And they never touch it.
They don't touch it, or they try it for a week or two and say, this isn't for me.
Yeah.
Whereas if we make a mouth guard for someone, 90% compliance.
That's amazing.
And so
It's easier.
yeah, it's so much easier. And there are people that are just totally intolerant to CPAP. And so have I given oral devices to people with severe sleep apnea? You bet. Because they can't tolerate a CPAP. Something, most of the time or all of the time, is much better than nothing.
Absolutely.
And so we can help them in so many ways with that, just by bringing awareness, educating once again, and then offering solutions to help them with that.
I feel like I learn something new every single time I talk to you, because you have all these different things that I just would never have known about. And one of the other things that you guys specialize in your practice now is aesthetics, and that's a whole other area of expertise that you have because of the amount of time that you guys have studied the facial structure.
Exactly.
So talk a little bit about some of the aesthetic procedures that you guys offer.
Sure. So when we talk about aesthetics, I mean, most people think dentistry and aesthetics. Okay, let's make my teeth wider. Let's make them nicer, and we absolutely do that. Let's make them straighter. Let's get some Invisalign in there. Let's get some braces. Whatever we need to do, and then restore them, make them look beautiful. And so I like to compare that to that's the picture that we really focus on those teeth. Well, the rest of the face is kind of the frame.
Yeah.
And so you can have beautiful teeth, but then we've got a little worries or concerns or crow's feet or whatever. It's nice to be able to work on the frame. So in our study for dentistry, we learn everything, head and neck anatomy, all the way through, just everything. Learn all about that. We're also very familiar with injections, right?
Yeah.
I mean, who
The
else
Novocaine
uses?
and-
We're using it all over the place.
Yeah.
And we're using it in very sensitive areas,
Very
trying to help.
tight corners.
Yeah, trying to help people with all of that. So who better when we talk about injectable, whether it's Botox, neurotoxin, fillers, or even PDO threads, who better to be able to be comfortable in that situation in a very sensitive area to be able to administer it. Now, obviously, there's training that's involved in learning the materials, but I can tell you it's not as involved as learning as a lifetime of dentistry and the intricacies of that. But it is so gratifying to be able to offer these things and make a difference. And of course, depending on the modality, sometimes there's an immediate effect, and sometimes you got to wait a week or two to see the full effect. But to be able to do those and help people, and we have people that come in for that, and they'll come in for aesthetics. But the important thing to understand with fillers, threads, and Botox or neurotoxins, because there's more than one brand of Botox, is that you can't divorce the aesthetic from the functional. You can overdo it to try to achieve a functional result. And I don't have any headaches, but I look like Cro-Magnon man, And so the thing I feel, and I'm kind of an incremental type person, is less is more.
Agreed.
I want to do just what you need to achieve the result, functional and aesthetic, that will achieve the desired result. And so it's important to, whoever you talk to about any of these type of things, that you find out their background philosophy, how they feel about it, what direction do they want to take, and how do they want to work with you? Do they want to work with you over time, or is it kind of like, let's get you in and let's just kind of do everything and then see where things fall? That's not the direction I like to go. I like to, let's try this, let's see how you do with this, let's see the results of that. And the benefit of that is then when people go out, you don't have friends go, oh, did you just get Botox?
Yeah.
Oh, did you just get filler?
It's so subtle.
Yeah. You want that subtlety. You just want someone, did you do something different with your hair? You look fresh.
Yeah.
But, and so that's important. That's important for me in terms of the way I like to work with my patients.
Well, and I think it goes back to what you said. It's you can't divorce the outcome with the cause. And at the core of what you're doing, you're your first interest is always going to be their health.
Absolutely.
But at the same point in time, you also want to help them feel better about themselves at the same time.
You have to take into account the aesthetic results of what you do. And this is true of all of dentistry too. I mean, I can make a perfectly functional crown for your front tooth and it can be all gold. And in our culture this day, that is not something that is very desirable.
We don't want that.
In another age, in another culture, that might have been very desirable. But that is not the case.
Yeah, that is not the case anymore. No, it definitely is not. So in terms of just your patients, is the typical recommendation people are getting their teeth cleaned twice a year? And do you see that?
I generally recommend that. Now, some of that is just so I can get eyes on them.
Yeah.
Just because, maybe they do clean things quite well, but maybe they've got
maybe floss.
That's right, or maybe they're a little more decay prone.
Okay.
Then we're getting eyes on that part of the situation. Or maybe they're trying to keep up their Botox or whatever, Botox lasts about 3 months. That's what we've got. And but I can get eyes on them. We have that contact. We can communicate it
and prevent other things
from happening.
Yeah.
Now there are some people that we'll see and who say, in your situation we've got some problems with the gums, and we need to see you more often. And so we'll see you every 3 months.
Okay.
Okay. And so it's situation specific.
Yep.
I'll have some patients, and there aren't many of these, that maybe they're a prosthetic denture patient, whatever. I only need to see them maybe once a year.
Okay.
And so we try to set it up so it's best for the patient. But I like to err on let me see you a little more often than just count on everything's great
fine.
And you're not feeling anything. If we leave it as, well, call me if you have a problem, then usually that problem is a lot worse
than
I've
had
had
been
a chance.
Preventable.
Yeah.
So what would be your best piece of advice just to the general public in terms of just taking care of their oral health care?
Make sure that you are invested, that you see the importance of it. Try to get that realization. And talk to your dental health professional about what's most appropriate for you. And be invested. I mean, no one's going to care more about the outcome than you.
That is so true.
So it's something that you've got to decide that this is something that's important to me. And it will pay off huge dividends, especially when you're in your 60s, 70s, and 80s. We're seeing more and more people that have most, if not all, of their teeth into that age group. And I think that's wonderful. If you go back 50 years and go to that same age group, you'd have like 60 or 70% of them have dentures.
Wow, I never thought about that.
Not very happy with them either, but they just make do.
Yeah.
And all the consequences of that. And so to have this older age group now that are keeping most, if not all, of their teeth, it makes a huge difference in how the quality of life as they get into those older years. But like with anything, right? I mean, we save now to be able to retire later. It's just an investment.
That's great advice.
It's investing in your health. It's investing in your well-being. It's investing in just the wonderful things of life, because you can eat so much better. You can have better food. You can enjoy food, and you can enjoy life so much better.
We only get one set of teeth.
Exactly.
Yeah.
Exactly.
That's really great. We're brushing our teeth and flossing today for our future selves 30 years from now.
Exactly.
And Dr. Foutz, you've been doing this for such a long time. What's your favorite part of your job?
Oh, I enjoy the variety that I have. I mean, if I was just doing one thing every day or one or two things, I think it would be easy to get a little bit burned out. But, I mean, my practice now is nothing like when I started 40 years ago. And, of course, some of that's to do with just what's available to me, okay? I mean, that's for sure. But it's also, I've tried to stay up on top of things.
Oh, yeah.
Stay with things that are current. As new things come out, to be able to adopt them and make things more pleasant and easy for my patients. And so I'm not bored. I'm still enjoying it.
Yeah.
I
You're
enjoy
still
it.
challenged.
Yeah, exactly. You know, a wise person once told me that, you know, you should feel really comfortable with 80 to 90% of what you do. The other 10 to 20%, that's your learning curve. That's where you're still learning and you feel that thrill of learning and accomplishing something new. And that just keeps things fresh. It keeps things fresh. And as long as you approach that appropriately and get the right education and learn and grow, it's wonderful to be able to offer these wonderful things to our patients.
I love it. And your office feels so welcoming and warm. If you had to say what one of the biggest things that would set you guys apart from other dental offices here in town, what would you say?
I think we love it that I think for the most part our patients are coming to see us for us. That not because we're on a list or because we're something like that. And so they really become like family. We know them, we know their families, we know their situations, and it's just fun. It's like greeting old friends every day, you know? And that interaction for me is just stimulating, and for my staff too. I mean, they love these patients and love working with them, and so we hope that comes through, and we're hoping that always comes through.
Absolutely, it does.
Yeah.
You know, even in our interactions too, you've taken the time to get to know my history, my family, you know, our story, and it makes it so much more approachable, because I think sometimes going to the dentist can be a little scary for some people if they've had some issues in the past that, you know, have maybe been painful or whatever else. But having somebody that you feel comfortable with is so important in your industry specifically.
It is, and you know, aren't we all about connection?
Yes.
With other people? Isn't that the core of just what brings so much joy to life? And so having that connection and being able to get to know, asking questions, you know, that's
Staying
so
curious.
important. Staying curious about all kinds of things. It's an important part of what makes my life fulfilling.
I love that. Well, if people wanted to reach out to schedule an appointment with you, do you recommend they call, visit your website? What do you think?
They can do either one, but making the phone call will be the easiest way. We do have our patient forms are online. They can download them, fill them out, and you can see a full recap of all kinds of history and things that we've advised in all kinds of areas. We've got, you know, weblogs that are in there, and you can see more about me and staff and everything. So
I love it. Well, thank you so much for making the time to come on today. We really appreciate it.
It's been a pleasure.
And thank you all for listening or watching. Either way, we will see you guys next time.